Kirsten, I'm the nurse, and this is Barbara, and she's a nursing student from Trinity Western University. Is that alright if she sits in with us today?
Yeah, that's okay.
So how can I help you today?
Well, I'm having a hard time with my asthma, my breathing, especially during soccer practices.
I'm really worried about my son.
Alright, before we discuss your asthma problems, how about we just make sure we're all on the same page? Can you tell me what you know about asthma?
Well, I know it's when certain things cause me to not get enough air into my lungs.
Does that make it difficult to breathe?
Very difficult.
So that's exactly what it is. It's when you're playing soccer, doing exercise, or sometimes stuff gets into your lungs and your lungs don't like that very much. That causes your airway to get smaller and some inflammation to come in, so it just makes it really hard to breathe, and then some gunky stuff called mucus can be produced, and all of this just makes it really hard to breathe. So I just have a really short video on asthma. Would you like to see it?
Yeah.
Awesome.
Air, or oxygen, is taken in through the mouth and nose. It then passes through the trachea to the bronchi. Asthma is a condition where the airways become irritated and inflamed. The bronchi are large tubes which are found in the lungs. Air flows through these tubes. The bronchi branch and narrow into tubes called bronchioles. The bronchioles continue to branch and end with tiny air sacs called alveoli. In healthy lungs, oxygen is taken into the body through the bronchi and passes into the blood via the alveoli. If you have an asthma attack, you may start wheezing. Your chest may feel tight and you may be breathless. The muscles in the walls of the airways tighten and the inner surface swells, causing the airways to narrow. An asthma attack can be triggered by exercise or an allergy, for example, both of which can irritate the airways. When the airways narrow, it's harder to breathe. Reliever inhalers are used to widen the airways so you can breathe more easily if you have an asthma attack. The inhaler contains a gas which propels the medicine into the airways so that the muscle walls relax and the airways open up. When the airways widen, it's easier to breathe. This is the end of the animation. Click.
Excellent.
Now I really understand asthma.
I see you have two different inhalers. Can you tell me what each one of those is for?
Yeah. So my pink one, I'm supposed to take twice a day, and then my red one, I usually take during soccer practice, and it's when I'm really having troubles breathing and I need some immediate relief.
But what do they actually do?
Alright, well how about we start out with your first inhaler. Can I see it?
Yeah.
So this inhaler here is your salmeterol and your fluticasone inhaler, and each one of those medications does a different thing. So the salmeterol inhaler, it is a bronchodilator. So see here on our lung man, it's going to help open up this airway. So this area right here is going to get bigger so that more air can get in and it's easier to breathe.
Oh, my airway gets bigger.
And then the fluticasone is it is a corticosteroid, and it's for anti-inflammation. So basically any inflammation here that could be in your lungs, just building up right here along the edges, it's going to get rid of this inflammation so that your airway is as open as it can be. So those two working together are going to work to make your airway bigger so you can get more air into your lungs.
Okay.
Do you understand?
I do. So these open up my airways so that more air can get into my lungs.
Exactly. Do you guys have any questions about this one inhaler?
No, I think I'm okay.
So you're going to take this one twice a day, once in the morning and once at night. Is that correct?
Yes.
Excellent.
Okay. Okay, I understand what it does, but sometimes I don't like taking it because it makes my mouth feel dry and my voice gets really cracky.
Those are common side effects of this specific inhaler. You can also get a headache, or you might feel really tired, or you could even get a fever. But for the specific side effects that you're experiencing, it's really important to make sure that you rinse out your mouth, so you gargle and you spit the water back out afterwards, and that should help to relieve any of the dry mouth or cracky voice that you get.
Okay.
So can you tell me what you're going to do after you take that inhaler?
So after I take this inhaler, I am going to gargle some water and then spit it out.
And that will help so that you don't experience those
All
side
the
effects.
dry mouth and cracky voice.
Exactly. So how about your other inhaler? What's that one for?
Well, this one I use usually in the middle of soccer practice when I'm having troubles breathing.
I'm really concerned that the medication isn't working. I really want to play soccer, but I don't even know what it does.
I understand. Well, this inhaler specifically has a medication in it called albuterol. And albuterol is going to help for your acute asthma attacks. So those times when an asthma attack will just randomly come on and you have difficulty breathing, like during your soccer practices. So first, let's just go over maybe what that medication does. So albuterol is also a bronchodilator. So that means, remember on our diagram here, you have the airway, and it's going to make this airway bigger to open it up so that you can breathe more and get more air into your lungs. So that should give you some relief of the wheezing and tightness that you get in your chest during an asthma attack. With this one though, you do have to be really careful, because if you take it too much, you can get a side effect called paradoxal bronchospasm, and I know that's a really fancy word, but it just means that it's going to reverse the effect. So instead of helping you, it's going to make it harder to breathe. So make sure you only take this when you're having difficulty breathing.
Okay.
Do you have any questions?
Well, you see, I'm kind of worried because when I reach college or university, I want to be able to play soccer. And even as it is now, my soccer coach sometimes won't let me play.
He won't let you play. I understand that that can be really difficult, and I know you really enjoy soccer. So with this medication, you can actually take it before your soccer practice, since every soccer practice you're having difficulty breathing. So if you take this one, take 2 puffs, 1 minute apart, and that should help just relieve any tightness that you get in your chest while you're exercising. So how often are you going to take this medication?
I'm going to take it at the beginning of soccer practice. 2 puffs, 1 minute in between each puff, and then just whenever I'm having troubles breathing.
That's exactly right. And also, just for you to know that there are support groups for teens that have asthma. If you're still experiencing difficulties or you're having trouble emotionally just handling all the stress that asthma can bring.
It's really stressful.
Yes.
Excellent. So can you show me how to use your inhaler?
Okay.
That's my boy.
That's not quite the technique that's going to work most effectively to open up your airways so it's easiest to breathe.
I just did a project on this. Do you mind if I teach you how to use your inhaler properly?
Okay.
Go ahead.
Okay, so first it's important to make sure that you're sitting up straight or standing when you take it, because this helps to open your airways. You can even tilt your head back a little bit so that the medication distributes into your lungs effectively. And then what you're going to do is you're going to shake the puffer hard 5 or 6 times to pressurize the medication, and then you're going to take off the cap and blow out all the air you can out of your lungs. So blow out until you can't anymore, and then you're going to put it into your mouth and puff and slowly breathe in as much as you can, and then you're going to hold your breath for as long as you can. About 10 seconds is usually ideal. And then after that, you're going to wait a minute, take the puffer again, and then rinse out your mouth and gargle.
Okay.
So
So do you have any questions about how to use your inhaler?
Nope, so I just give it about 5 good shakes, blow out all my air, inhale it, hold it for about 10 or so seconds, and then breathe out. Wait another minute and take another one.
Yeah.
And rinse my mouth out.
And if you're having difficulties taking the medication that way, there is a spacer that you could try, and it just, then the medication goes into the chamber first, and then you breathe all the medication out of the chamber, so it helps for people.
I think I'll be good with just this.
Okay, well, if you ever have difficulty, you can come back in and we can get you a air chamber.
Okay.
Do you have any questions at all?
No, I think I understand. So I know that this one I'll take twice a day, once in the morning and once in the evening, and it just helps keeping my airways open so that I'll always have air flow nicely. And then this one I'll start taking before soccer practice or just whenever I'm having troubles breathing, and it will also open up my airways and just allow me to breathe more easily.
And what are you going to do after you take your inhaler so that you don't experience the side effects of kind of a hoarse voice and a really dry mouth?
I'll be sure to rinse my mouth out by just gargling some water.
Exactly, and I have one more question for you. How many puffs are you going to take before soccer practice, and how long are you going to wait in between those puffs?
2 puffs and 1 minute in between.
Exactly.
So you can take this handout with you. It has the picture of how to use your inhaler just in steps, and then there's also a list of the steps on the back here, and we've highlighted the instructions specific to your inhaler.
Awesome, thank you.
And I have just 2 more handouts for you guys. This one here just describes what asthma is and just kind of gives you a brief overview of the medications. Just in case you forget, you can just get a review. And I have this one here specifically for you, and that one's just going to talk about asthma, what it is again, the medication specifically for parents who have children with asthma. So if you have any questions, you guys can let us know. There's lots of online resources to look at as well. There's the Lung Association. Do you guys have any other questions?
No, I think I'm good. Are you good, Dad?
Yeah, I'm good.
We're good.
Excellent. Well, feel free to come back anytime if you guys have questions or are having difficulty with your inhaler, the medications, or you're confused at all. And yeah, just let us know. Just make an appointment.
Thank you so much.
You're welcome.
Thank you.
Thank you.
Thank you.